joining us today for the Suicide Prevention Committee meeting. Today is Wednesday, June the 25th. We are meeting at the Public Health Department, and it is 5:31. I will now call the meeting to order. And one of the things that we're going to do is just do a small reflection before we do the roll call, because I know a couple of members might be running a couple of minutes late. So if everyone could just please allow me a couple of minutes and let's do a quick reflection. Heavenly Father and everlasting God, thank you, Lord, for another day of life, for giving us your blessings, your mercifulness amongst us, for everything that, God, you see that we do that maybe it is not to your liking or your approval. We ask you for forgiveness. We invite you, Lord, to join us during this time as we share, network, and discuss ways that we can improve our community. Lord, we can't do it without you, so please join us. In your name I pray, Jesus Christ, amen. Amen. Now we'll go ahead and do a roll call. Angie?
Dr. Julie Passan,
Present.
Maxine Reyes, Edwin Martinez, Miguel Rangel,
Present.
Marisela Jackman, Earl Medina,
Present.
Gabriel Martinez, Marina Enino. Present.
We need one more for a quorum, is that correct, Angie?
Yes.
Very good. So we will go ahead and skip the action items. Do we have anyone for public comments?
No public comment.
Thank you. I want to go ahead and just take a moment and go around the room. If you can introduce yourself and the agency that you're with. Somebody's at the door. It would be very important so that we all know who's at the table. I see some new faces, so I think it's very important to do that. I want to start by introducing one of our AHIC team members, brand new, so I'll let her introduce herself.
Hello everyone, let me just share a little bit back. My name is Maria Garcia, nice to meet all of you guys. I'm Ms. Dr. Basan's new administrative assistant. I'll be working with her in AHEC, and if you guys need anything or anything, just let us know. We'll be more than happy to help you.
Thank you.
Thank you, Maria.
Hi, my name is Adriana Morales, Harm Reduction Specialist with Diario Public Health.
Hi, my name is Dennis Grillo. I'm the Licensed Professional Counselor Associate at AOT.
Hi, good afternoon. My name is Adriana Rodriguez. I'm a caseworker at AOT with Diario Public Health.
Hi everyone, my name is Kathleen Chavez. Here as a health education promotion manager at Diario Public Health.
My name is Carlos Leon. I'm a promotion specialist with Anora Certified. Hello everyone, I'm Akil Moses. I'm the community health administrator here at Jordan.
Hello everyone, and my name is Earl Medina. I'm co-chair and I'm representing District 5 and president and founder of Orgullo LOU68.
My name is Marina Medina. I'm representing the Figueroa District 8, and I am the founder of Mike's Purpose.
Cynthia Diaz, I'm the Director of Student Health Services and Wellness at Diario College.
Miguel Rangel, I'm representing Melissa Sierra, District 3, Concern Citizen.
Frank Sanchez, Supervisor and Suicide Prevention Coordinator at Border Region Behavioral Health for the Children's Department.
Hi, I'm Laura Cortez. I'm the Director of Special Programs and Projects at Border Region Behavioral Health Center.
Hello, my name is Marie Lambert. I'm the LCDC for Pillar.
Hello, my name is Sergeant Heriberto Avalos. I am the direct supervisor for the Mental Health Unit at the Laredo Police Department.
Blessed afternoon, everybody. Sergio Moreno, National Border Patrol Council. I'm the Suicide Prevention and Crisis Prevention Advocate for the Border Patrol here in Laredo.
Marisela Jackman, representing District 4. Councilman Rick Garza.
Good afternoon. My name is Fabiola Espinosa, and I'm a case manager for the Frontera program, where we offer counseling services, psychiatric services, and medication as well.
Good evening, Eva Ortiz, West Care, Project Coordinator and Prevention Manager.
Good evening, Manuel Latte with West Care, Texas, Peer Support Specialist with DSC PACE and Licensed Specialist Coalition.
Good afternoon. My name is Jacob Rios. I'm an American Public Allies, and I'm with West Care.
Thank you. And I am Dr. Julie Bazan. I am the chair for this committee appointed by our mayor, Dr. Victor Trevino. And I just want to make a note for the record, we do have Ms. Marisela Jackman as part of our committee, so we now have a quorum. With that being said, I want to go into the approval of the minutes for May the 28th. Committee members, while we are looking at that, I just want to remind everyone around the table that we welcome your input and discussion. But whenever there's an item that we need to vote on, it is only the committee members that were assigned by the different council members and the mayor that can vote. Just a reminder for all of you. So the minutes for May the 28th, thank you, Angie, for sending those out. And I'll wait a couple of minutes to see if anybody has any questions.
I make a motion to approve the minutes.
We have a motion by Mr. Rangel. Is there a second?
I'll second.
Ms. Jackman seconds that motion to approve the minutes. All those in favor say aye.
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 All those opposed, same sign. The motion carries. Thank you so much. We will now move to the next item, which is the City of Laredo Police Report. Sergeant Avalos.
Good evening, everyone. I have good news this past month, we didn't have any suicides. I was talking to Dr. Bazan, and I don't know, it was maybe because everybody's out on vacation or somewhere, it's stress-free. Hopefully it continues like that. But it's always a good sign when we don't have any suicide. It's always a good sign. You want to move forward? Between January 1st and all the way to June 24th, attempted suicide calls. For 2025, we've had 52 attempted suicide reports. We've had 98. Suicides resulting in death is 12. Emergency detention reports 293. Emergency detention calls 365. I know it's still barely June, but we still have, I think we're still ahead of what we were at last year. So hopefully it slows down, and that'll be it for this year. Moving forward, breakdown on the attempted suicide calls that we received this month was on May 28, 2025, attempted suicide, 50-year-old female, overdose. June 20, 2025, attempted suicide, 50-year-old male, overdose. And June 2023, attempted suicide, 32-year-old male, by hanging. First call was by the 11,100 block of Revilla Drive. It was the overdose on Wednesday, May 28, 2025. At approximately 3:56 p.m., police responded to an attempted suicide call and located a 58-year-old female who attempted to overdose on pills. Female was detained and taken to a local hospital to receive further mental health. She has no history of being a patient at Boulder Region. Next call was 200 Lobo Loop on Friday, June 20, 2025. At approximately 8:34 a.m., police responded to an attempted suicide call and located at a 50-year-old male overdosed on pills. The male was detained and taken to a local hospital for further mental health help. He is a patient at Boulder Region. The last call was by 5100 Linasa Lane on Monday, June 23rd, 2025. At approximately 7:40 p.m., police responded to an attempted suicide call and located a 32-year-old male who was attempted to hang himself with a belt. The male subject was detained and taken to a local hospital so that he could receive further mental health help. And this person did not have any history of being a patient at Boulder Region. As you can see, the heat map, where the calls pretty much originate from. Any questions?
Sergeant, those, on the heat map, you have them by districts. Is that what that is?
Yes, sir.
Or zip code?
It's districts. That's our districts, of course. That's the way we have them through our
For you
system.
all?
Yes.
Oh, okay.
But just from the looks of that heat map, you can see the top two are probably 45, 78045, and then the middle section 78041, and then the bottom is could be 43, 46, depending. So it's evenly
Yes, ma'am.
distributed. Does anybody else have any comments or questions for Sergeant Avalos?
Sergeant, you go back to the slide with the phone number? Or
Back to the
phone number
slide.
back?
I'm sorry.
Go back.
There.
Thank you.
Like I said earlier, my name is Sergeant Heriberto Avalos. That is my work number. That is my work email. If you have any questions, that is my number. And these are my officers that work with me, Officer Jacqueline A. Davalos, Officer Emerson Barbosa, and Officer Gilberto Ramirez. They were a great team, very knowledgeable, very experienced team.
Thank you, Sergeant Avalos, and I just want to say that I'm so happy to hear that there's no more numbers for this month, and of course, the number of attempts also decreased. And I have to say that that has to be due to the fact that there's also more advocacy. Of course, the public health department team is doing a fantastic job, and the rallies, believe it or not, they do impact people. And we might think, oh, nobody pays attention to it. Here's a perfect example of if we all do our part in different ways, we get the message across. And so please, I invite all of you to continue. Let's not lose the momentum. It's summertime and people are out and about, so they will see the message that we deliver. Thank you, sir. The next item is update on current projects, and for that, the 988 falls in text statistics. And Mr. Montes.
Yes. Okay, so through our research, we ended up identifying that Integral Care is the organization that handles our phone calls for 988 for the state of Texas and for Webb County. We had some emails exchanges, and we got these metrics. So total calls routed to Integral Care is 1,295. The calls answered by Integral Care 1,083. And if we do that math, it's 83.6 answer rate. We established that communication, and we'll develop the relationship. We were able to establish that after the 15th. We're going to be able to reach out to them and start getting monthly data. And we're going to work on developing a dashboard as a historical. We established that historical context in the months that are coming up. They did mention that the chat and the tech support was limited. It was a state pilot, and that there was no localized data available. So again, there's no breakdown. I did ask if there was any call metrics like demographics or the nature of the call, and they're not collecting that at the moment.
For the chats and the texts.
Yes, and also the phone calls. Yeah, the phone calls they're doing apparently is frequency calls, frequency counts.
So I just want to take a moment, Mr. Montes, because I saw that email that was going back and forth, and it was a lengthy conversation, and you never gave up. So thank you for that, and that's the kind of persistence that we need so that we can get the data to make informed decisions. Thank you so much for that.
And then from here, I'm going to share the other data dashboard that many of you may all be familiar with already, provided by Samsung. And this is the dashboard that collects, there's a QR code, you can go directly to it, and this is the national data. It's not broken down by state, it's just a collection of the entire, all the national call centers will be received. And just looking at it, I just wanted to point out that if you visit this website, that you can go ahead and click these tabs in here, so you can get different, further analysis and breakdowns. And then on this one, I noticed that the data it covered up until February. And their preliminary is that there was a lot of routed calls, as you can see, as they're going up. As opposed, I'm thinking that since we got that 83% answer rate, I'm assuming, based on just the observation, that it seems to be that the call volume is high. Routing those calls to the call centers at an actual. So I provided context there that it will allow us to use the national compared with the local data and see where we're at. Once we break down and get this historical data, so we can make some comparison cross-reference. From there, we're highlighting, just providing an update where last month we had 26 barbershops and cosmetology and beauty salons where we conducted our outreach. Again, this stems from our mental health professionals stating that those are a good place to reach our target demographic, 18 to 35-year-olds. So we expanded it this last month. We reached to 19 additional businesses, and that brings our total to 45. This QR code, when you scan it, it gives you the map live to see our engagement. It brings a version of the map so you can see our outreach.
Anything else?
Sorry?
Do you have anything else?
No, I'm gonna go.
Good job. Way to go and get 19 more people signed up.
Yeah.
That's
That's
excellent.
45, yeah.
And so it's only barber shops? What about hair salons?
I'm sorry?
Hair salons? does
Hair
that-
salon, yes, it encompasses. Since we're targeting males, we went to the gun shops first, barber shops first, tattoo parlors. We have to do more tattoo parlors, we went to the barber shops first, but there's beauty salons, cosmetology schools. Something that's not captured here is that we secured a partnership with Next Top Barber Academy, and we're gonna integrate the mental health first aid training into the academy. So when they go out, they go to the training. So we secured that with Dr. Garcia, Dr. Aula Garcia. So the next cohort, we're anticipating like September, and there's a group of 30. I was very attentive to the feedback. They'd like to see if it is something that we're maintaining a good pulse on, right? We're on the right track. And they mentioned, yeah, we actually do get a lot of conversation from our patrons and customers, and they've mentioned that, yeah, it would be a good thing to develop that training. So from here, we were tasked with finding a solution where we could come together as a committee to share ideas and a data repository and files and agendas, etc. It's even a virtual meeting space. And I know, I believe Ms. Jackman had mentioned about Microsoft Teams, right? That's a very excellent platform. The thing is that I think some of us would need licenses. So this is the closest thing that I'm proposing to the committee that we consider. And I purposely left it text heavy. So if we share this PowerPoint slide, you guys can reference it in the future. And in short, it allows a space for us to have organized channels and sections. On the left, what happened is that I set it up and I got blocked by the city. Yeah. So I was gonna try to show it here. Yeah, the firewall. But, so we can test it out, right? And then we can check it out. And in here, I was able to take a screenshot on my phone to kind of show how it looks on the mobile version. I already have a list of channels, proposed channels that we can implement here. right? And as we build upon it and we add users, we can go ahead and develop that, sections for, we tried even, there's a mental health bot, right? We added to the chat, and it seems to be working, so we can check that out. We could just, maybe vet tools that we can share with the community and the city at large. So this particular link is for the Google Play download. The iTunes, Discord does exist for the iTunes. Again, because of the firewall, I wasn't able to get the iTunes version. And if you already have Discord, this is the server to our channel. So on the right, so there's a download for Google, and on the right is the server. So moving along. Okay, I'll go ahead and hand it off to Ms. Kathy.
Hi everyone. I just wanted to share this training that I previously went to I think about a week ago, and it's called the QPR training. I think you all, some of you guys might be familiar with it, but I got a whole look at everything. But it basically stands for question about suicide, persuade the person to seek help, and then refer them to resources. So it was offered by TAMU for free, but the downside is that it's only offered for current students and current staff and faculty. I haven't been able to find an organization locally that offers it for free for everyone. So I just want to throw it out there in case your organization has funds or is thinking about what kind of certifications to give to your staff. I think this would be great. That way, if we have a trainer in Laredo, we can duplicate all of our efforts here, and we can all be QPR gatekeepers. Anyone is eligible to do it. You don't need to have certification or anything like that. But just wanted to throw that possibility out there for any organization who's looking out for it. And then I did want to show, after our internal Laredo Public Health meeting that we had on May 19th, we came up with some events to target men and their mental health, just because of how it's impacting based on the data. So today we had the the stigma event today from 10 to 12 p.m. and we had a good turnout. I was able to get some photos from this morning. We had organizations like Texas Workforce here. We also had our local partnerships and programs, and it was a great turnout. A lot of men did come for the haircuts. I know Ms. Morales mentioned there was a lot of them who came early, already lined up. So they're able to get resources and also get a free haircut. And we hope to continue this as well. And then in the next slide, we also have another event coming up on June 28th, which is also targeted for men as well, since it is Men's Health Month. So that's where we kind of targeted that population. But we're very excited. It's going to be on this Saturday from 8 a.m. to 10:30. So in case you all want to share with your clients, families, anyone who is interested, that's going to be happening. And all of these events, you guys can also see it at the Laredo Public Health Facebook page and Instagram as well. And these are kind of all of the events that we've had so far. And I'll pass it off to Dr. Montes to talk about the symposium.
Yes, this is a symposium I came across while doing some research, and it's the Texas Suicide Prevention Symposium. It is a virtual event, and I provided the QR code for those of us that can attend, so we can go ahead and register and gather more information.
To piggyback on Mr. Montes, I suggest if you have time, register. It's a great event. 2 years ago, they had it virtual. 3 years ago, it was virtual. The speakers that they had were great. Of course, there's a lot of funding at the time. Right now, there's a lot of uncertainties based on what's happening, of course. So they have great resources. And of course, it's also geared towards the military community. They'll have the veteran section on it as well. And Ms. Basan went and accepted that award, what was 2 years ago? Ms.
2 years ago,
Dr.
yes.
Basan, 3 years ago. So last year they had it in Mesquite, Texas. This year there was no way it was gonna happen because when they had their conference for suicidology, people were dropping out as presenters. They didn't know if they were gonna have a department as they were presenting on that day. So it's a lot of uncertainties, but you do have they call it, what's it called, those viewing parties. So if you can have your staff or your organization participate and you know, be part of it and different sections that they might have or whatever applies to you, it would be ideal. Just you.
Thank you, Frank. That was an amazing conference that I went to, and yes, I agree with you. Excellent speakers, the content was just content that you don't find anywhere else, and then what's even more impressive is the presenters they stick around to visit one-on-one with the audience, so it's a shame it's not available face-to-face, but this gives us all an opportunity to join in, whether it's for 1 hour, 2 hours, whatever it is. I like the idea of having an office party, I like parties, so
That's
we'll
what they
probably
call
do that.
it, a watch party.
Yeah,
Yes.
we can have it on throughout the day, and whoever's available can go in and watch. Anything else, Mr. Memphis?
No, that concludes.
Thank you so much for your report. Any questions for the Public Health Department on any of the items presented? Comments?
Good work.
Okay, we'll move on to the next item. You are not alone, awareness. And I just want to say again, thank you to everybody that's taken part on this. This Friday, we are having a 90-day rally from 11:30 to 12. And of course, we invite everyone to join us. If you cannot come to that location, you can select your own location, even if it's to stand outside your facility with a sign or shirt, whatever you need, please let us know. Like I said before, the efforts that combined are the result of maybe the numbers going down. We don't want them to increase, but it takes a full team to do this. So please, if you have any ideas as to how we can create awareness, share, share, share. With that being said, I know that September's just around the corner, so please put on your thinking caps and come up with ideas so that the entire month of September we can have activities happening like we did last year. Last year I know that there was a whole list of events that happened throughout the month to create awareness. And we will kick it off with probably a proclamation that the city will help us schedule, like we did last year. And then we'll do the 5K walk, run, mental health wellness fair at the North Central Park. And I'm sure we're just probably gonna plan something, and Pillar and all these agencies around the table. Please, please. One of the things that was really impressive last year was that the school districts, during their pep rallies, the seniors would walk out with a sign and show that you're not alone, 90-day, and that was really popular, and then they would march to the cafeteria. And I know this because we lent them all the banners we had available, and so something like that created, especially if you can get the youth involved, that's even better. So I welcome your suggestions. Maybe at the next meeting you can bring those ideas. It's not too early to start planning. And in regards to the training, I like the idea of training. I'm gonna see if we can contact them to invite them to support the message that we're trying to get out, and maybe we can work out a deal with Planning Youth. Again, the more trainings that all of us can receive, the better it is, because we'll be prepared to respond or refer someone in need. Any questions on the You're Not Alone awareness? We have some materials in the back. Thanks to Mr. Rangel that brought some posters, and thanks to Maria that brought a bracelet with the positive messages. If you would like some, please take some. We have plenty. We're gonna be taking them on Saturday for our summit.
There's lots of posters, lots of magnets and other forms. If you get a chance, just walk by there, see what you like. Please take what you can. And all these supplies are available for free. We got them from the SM. So just careful when if you order too much, it's really heavy. Yes.
And also, I just want to acknowledge Mr. Rangel because he's everywhere with that sign. He's like a walking commercial. much, that means a lot to me, and I know.
Only
the
takes
committee as
one
well.
person to change somebody's life.
I know, the other person also is Mr. Moreno that continues to be our advocate throughout his agency, thank you so much.
Appreciate it, thank you.
You never know when someone is gonna need to hear that message, so please continue, thank you so much. The other item, we go into update on new projects, trainings, we just kinda touched on that. Laura, do you have anything coming up for Border Region as far as schedules for training?
We are having, mental health first aid trainings that we are going to be giving, in the month of, I wanna say July and in August. And we, as you mentioned that you're having the 5K run, we're going to have a walk at our center so that more people are aware of where the local mental health authority is, and that's for September 13th. Time-wise, I'm still working on that, but probably be in morning time, and it's September 13th. That's a Saturday.
So for now, we can mark September the 13th, and I think last year was a successful event, right?
Yes.
I really enjoyed that. Any other trainings or announcement?
Dr. Lozano?
Yes.
I did 2 trainings with SCAN, a mental health first aid for adults and for youth, and they were very helpful, and my wife goes, "Who are you?" So, yeah.
You've been transformed.
I've been transformed, yes.
Thank you, Transformers. Thank you so much, Mr. Rangel. Mr. Montes, I was gonna ask you, do you know if Dr. Garcia has future trainings already scheduled?
It just, the one that we worked out with Nextcom.
But that's
Barbara,
kind
I
of
think,
booked,
yeah, that's
right?
already booked.
Okay.
And then I think right from here on, she has OBHP, and she was booked till after
That's true.
September.
Very good. If anybody knows of any trainings, please share with Angie so she can share with the membership, or send it to me and I'll share. There's always opportunities out there. Okay, the protocol for families experiencing a loss, Ms. Wackerman had to leave, so we'll come back to that next month. On September the 6th, I already mentioned that we have the 5K run, mental health well-being fair. Whatever funds we collect is gonna be to support our efforts, because as all of you know, we mentioned last month, we don't have a budget, and I know Marina mentioned that about a fundraiser, to sell popcorn or something like that. Oh, there it is. Okay.
Yes, it's right there, Doctor. So here's some samples that he gave us. So right now. it's
Pretty
yes,
sample.
you all-
Oh, sample.
Oh, my God. That goes good with
We're
a
gonna
bowl
open
of
and you all
cold
can
water.
try it.
Or tepid water, it's tepid water.
So,
Okay, anything with cheddar, white cheddar?
They're delicious.
Now, remind me, about the funds on this, Marina?
he told me that, we all can take one of these, and then I don't know if next month y'all wanna bring it in, or unless you wanna meet in 2 weeks, Doctor, I don't know, maybe at AHEC, and we turn them in, and whatever, we collect, he'll give us 2 weeks to bring it back and we can distribute it. But whatever we sell, it's $10 a bag, and whatever we sell, he keeps, we keep $4. And that, money, we could use it for
Whatever we
whatever
want.
we need to, yes.
So since you're the lead on this, you tell us when you want us, when is the due date to sell?
Okay,
And if someone has it, let's say tomorrow I sell the entire list,
okay.
I can take it to AHEC tomorrow and it'll be dropped off and collected and documented that I turned it.
Yes, we just need a date where we can, let's say we can sell for 2 weeks.
Okay.
And then we collect the money. I don't know if you all wanna vote on the 2 weeks or a month, or he says 2 weeks is better.
Okay, before we vote, I just want to acknowledge Maxine, thank you for joining us, another one of our members. Even though Ms. Jackman left, Maxine is here, so we still have a quorum. Let's look at the date for when this will be due.
So,
July the 10th?
Do y'all wanna do the 10th or do y'all wanna do the 18th? 18th?
And if we need more of these, we can.
I have 'em. I can give you some, and if you need to, if they need something, you can get them at AH with you?
Yes, give them to me, and whoever needs more, they can pick them.
Yes. And, we're hoping that everybody can at least sell, like, how many doctors did you want for them to sell?
Well, how many do they have?
It's 30. It's 20 here, I mean, maybe 10, 15. That's 20. Everybody see an extra, you can do it.
$200.
Because maybe, let's say one person wants, they wanna try all the flavors, pues ya son ahí las.
You gotta give us all the flavors.
That's what I did.
Remember that summertime, people want something to snack on. so
Yes,
take advantage
and
of all
it's
the events.
super
There's some good shows on Netflix, let me tell you.
Yeah, super good. And you was gonna go get some, foam cups, so we can try it right now.
Okay, so it's July the 18th when the ballot is due, and let's see. If you want me to pay the office, you're welcome to do that, we'll have the pizza party. Yes. Okay, we'll send out a note, Marina, can you prepare something for that day? And we'll invite everybody to come and brag about how many you have sold and turn in your money. And, there will be a prize for the top selling individual.
No pressure.
I know who's gonna win already, so. I don't wanna say any names.
He said he's working on an outfit that says 988, superhero outfit with a cape.
I thought about it.
Because they kicked him out of his bedroom. So he went in there with a 988 sign. No.
Thank you, Marina.
I thought you knew him.
I do know him.
You know he's perfect. You know he's perfect.
Okay, before we open it up for announcements, I just wanna give us our homework for today because we have great presentations. There's three things. Number one, continue to advocate for the 98 You're Not Alone. In spite of what's going on around us, whether funding is going or coming, look, there's people that still need help. If that number's still available, we're gonna refer them to 98. Why did we start promoting this message? I've been asked, why 98? It's the easiest way to tell someone that there's help available. And when we discover another way that's easier, we will also promote it. So 98 is easy to remember and it's something that you can just tell someone about. So let's continue to do that, promote and advocate for 98, get people to seek help. Number two, look at the information that Mr. Montes sent us on that platform, which is called, I wrote it down, what's it called?
Discord.
That. Download the app, look at it, and our homework is to give input, and next month we can decide if that's what we want to use, because we definitely need to stay connected in one way or another. And if this is the easiest way that can work for us, let's do it, okay? The third thing is to look at the fundraiser that Marina's sharing with us and mark your calendar for the 18th of July. What time did you say, Marina?
July 18th, whenever you tell me, it's your office.
It's up to you. Y'all wanna come at noon or in the after work?
Before noon.
At noon?
Yeah, I'll go before noon.
Okay, so Marina, send us a note.
Okay. So afternoon siempre?
At noon.
At noon?
So come by, we'll have pizza and drinks and we'll collect your money.
I'll send them, okay, I'll send them a note.
So that's the homework, the three things we have to do. Announcements from anyone about anything that's coming up that you'd like to share with the committee? Announcements at West Care?
Everybody wants to grab the popcorn.
We are with, we're together with, Latest Voices for Coalition, so it's, West Care Holding Institute, Pillar, Holding, CIS, Casa Maria, we're all together. We're working on an event at, Step Academy at the gym, August the 9th on Saturday, 9 to 12, so anyone that would like to go, they need services over there. So if you have resources that these people can take advantage of, we need to help them. We have a lot of kids, underprivileged kids there that need a lot of help as well. So everyone's welcome. They need school supplies, we're trying to get backpacks as well, medical, vaccines, things like that. So anything is helpful.
So this is August the 9th from 8 to 12 at where?
Well, we start up at 8 and it's 9 to 12 at Step Academy in the gym.
And it's a back to school event?
Yes.
It's in the district requiring clear.
Yes, clear backpacks.
And I understand that this time, for this school year, the districts will not be providing the clear backpacks, so just keep that in mind to support some of our families in our community. Any other announcements on this side of the table?
I have one. Yes, hi, Elena Morales with Battle Public Health. I just want to remind everybody about OVH, Operation Water Health, which is happening next month, July 21st to the 25th. From 8 to 3:30, the doors will be open for community members to come in. This is an exercise, a preparedness exercise that every year borders around Texas have at the same time. You're talking about Mission, you're talking about McAllen, you're talking about other border towns that have Operation Border Health. This is to make sure that the city is ready and prepared for an emergency. What happens is that in order for us to be prepared, we need to also invite the community and provide services. So we have services such as vaccines, doctor visits, and medical physicals, as well as screenings. There will be mental health screenings. Usually, Border Region is the one that provides the screenings, as well as other services such as tobacco cessation. We have Texas A&M providing nutrition classes. We have dentists there as well that will even, if you need, if the patient comes in a really bad state, they even do root canals there. They provide vision and hearing. They'll give you the free glasses. It's a whole array of different medical services, free, completely free to the community. So if you want to put a booth at this event, you can. You can contact the booth coordinator. I am the volunteer coordinator. So if you know anyone that is interested in volunteering, we have different schedules. You can call at any time, any day of the 5 days. Just give me a call. I'll send the information with Ms. Angie, so maybe she can forward it to everybody here. You'll be able to register as a volunteer, or if you want to have a booth, contact me and I'll share your contact information with Ms. Shari Bellis. She is a booth coordinator. Some of you have been at this event before, and I want to just to re-invite you again.
Thank you, Elena. And yes, we want to have a 988 exhibit, and I'll order a tablecloth so that way whoever's available can go by there and just represent our committee. One thing is to talk about something, and another thing is to really act on it. Okay? So thank you so much for your report and your announcement. Anyone on this side of the table? Announcements or anything to share? Anybody win the lotto maybe? That's why you were quiet, right?
It's today, so.
Oh, okay, sorry. Thank you so much for all the great work that you all do here at Public Health. Any announcements or anything to report?
I just want to say we're going to have our 5K run and walk on August the 2nd. It's going to be for overdose awareness. If anybody wants to set up a booth also, I'll bring some information for next month, and we can go over there. It's going to be at North Central Park. Okay? And we're going to proclaim the month of August as Overdose Awareness Month. We're going to do the campaign Turn the City Purple, where you light up your porch light purple. And so support, what else? There's going to be, we have a...
Yes, so SCAN will have it, August is Overdose Awareness.
Yes.
Because of that, we are trying to bring the community together and organizations together to promote different events. Max Purpose has around 3 or 4 events that month. We have a collaboration with SCAN for the Candlelight Vigil. Then the health department is also organizing a street party like we had last year. We had a block party, now we're going to do a street party. And there's other events that we wanna make sure to integrate other organizations, so we'll be talking to AMA, we'll be talking to Roots, we'll be talking to WestCare in the coming month to organize events for the month of August or Overdose Awareness Month. So it'll be a month full of events in respect to overdose awareness.
I love the momentum, and I would love to see that for the suicide prevention and awareness. It takes all of us, remember? And who says, we don't have to reinvent the wheel. What are they doing in August that they could do in September? And I'm not saying to do everything, but you know, so be creative and just say, I'm gonna take care of this. I'll organize this and contact her and say, where do I start?
Yeah.
So thank you for the ideas, thank you.
And there's gonna be a press conference July 8th. I'll send the flyers so you all can, do you wanna go?
Please.
Thank you.
Earl, anything to report? Thank you. Anything to report for LIC? Maxine?
If anybody wants to take pictures, so I can start putting them out. I know I'll put it out to the committee members first, but there's certain pictures. I can put the samples in the chat for the rest of the members. But I just need you to pose. That way, hopefully, the community will react seeing someone familiar as opposed to some random person on a poster.
So you want us to take our picture, or you would take our picture?
Either way, like I put a whole bunch of examples, and you could just see like some of them are on their phone, some of them there's not a lot of selfies, but you could probably set your phone up and it takes it close by anyway.
Okay.
But they're pretty simple pictures. They're not sad or anything like that. That's one of the big things. Don't look sad, no crying, anything like that.
Okay, so that we'll add that to our homework for next month. We'll have plenty of pictures, so we'll do a collage.
Okay, yeah. If you already have some, you can send them to me. It could be with a partner, family, a dog, whatever you want.
Perfect. Thank you, Maxine, for taking on that project. Mr. Rangel? Nothing to report?
Thank you for all the work you guys do. Keep it up. And you'll see me out there with my sign somewhere.
We're gonna see you on Friday. Frank?
With us, we're just, we just trained in last month in comp training for our staff and ASK. That's another gatekeeper training that is available. That training, whenever it comes up through SPRC, I will let y'all know if anybody wants to get trained on that, because it's a free training. So they have a, on the website it says that it's a 1 hour training, no such thing. It says that it's a 2 hour training, no such thing. It takes, because the second one with a certificate, it has a CALM part, Counseling Against Lethal Means. So those trainings actually take about 1.5 hours to 2, the first one, and then the second one is about a 3.5 hour training. So it's up to you when you get trained as a trainer, and you provide your staff, whether it's the training where they just know how to be gatekeepers, and a gatekeeper is like CPR, mental health CPR, knowing where to refer the person for mental health issues or help. Okay, person that is in distress. That's what a gatekeeper training is. So they on that training when we provided, it does indicate where would you be better off getting help for a heart attack? And would it be Laredo? Well, of course, no. Would it be San Antonio? Maybe. Medical Community, Houston. Seattle. Why Seattle? Because they have the most people trained in CPR. So that's why they call it mental health CPR. So that's what you want to have, a community that is aware of where to send, where to get help for those individuals that are in distress or contemplating suicide. So,
excellent.
Okay.
And yes, I agree with you. The entire AF team is trained for that.
Yes.
And it took us a while, but we did it. We all did it together. And it was really a breakthrough for us.
And as soon as they push out the dates for that, I will share with you.
Anything else to report?
I just gave a adult mental health first aid training in Edinburgh at the Edinburgh ISD. So I was a co-instructor. And so they were very receptive. We're working on training EMS, a team of EMS.
Great.
And that's forthcoming, I want to say July. And in August, while we do our trainings, we go on our, to train in Rio Grande, Roma, and all of that, because that's our catchment area. So it's Rio Grande City and Zapata, as well as Hebbronville.
Thank you so much. When you get those dates out,
Yes.
share them with the group, because
I'll be
maybe
happy.
somebody's gonna be in the area and they wanna attend, and.
Yes.
And I know we also have contacts in those regions, so we can share those dates as well. Thank you.
Sure.
Anything to report? Pillar? Nothing to
Hunter's not
report?
here.
So.
Well, thanks for coming.
Thank you. Well, I hope you come back next month.
Thank you.
Thank you for being here. Sergeant Avalos, anything else?
No, ma'am.
Keep up the good work.
Thank you.
Mr. Moreno?
No, thank you, everybody's doing their organization. Fabulous work, guys. Collectively, as this component, we're making history. I see it reflect already in my workforce. So thank you, and thank you, Dr. Osan, for leading the troops.
Thank you, Mr. Moreno. Thank you for everything y'all do. Anybody else? Angie, anything to report? We do have a vacancy, just to remind everybody, we're waiting for that council member to, appoint the representative. And other than that, I think through the committee members, we try our best to do the good work for the community, but we couldn't do it without all of you, so please continue to attend. And again, any ideas, suggestions, don't wait until the next meeting, because maybe we can start working on it before we meet, and then we'll have a full report.
Dr. Basan, I know I did have one, but I was out on vacation during that time. I know that Randy Villanueva, our military veteran here, he had and I have pictures on our Facebook page for Border Region. There was a 32-mile run from Laredo to Zapata, and it's to help it was an outreach. It's called the Chain of Hope. And that Chain of Hope was to give support to military veteran families who have had a family pass away to suicide. And it was very moving.
It was very moving, and I was so proud to be there and to witness his efforts. And let me tell you, 32 miles, it's a stretch. And he never gave up, and it was beautiful to see him committed to the cause, to support his brothers and sisters who served our country, and to create awareness. And this is why it's important that we continue to tell people it's okay to reach out for help. And don't be ashamed. And if you don't know where to find that help, I can help you. So 988, remember that. Thank you, Laura. And he was gonna make it today, but he had another meeting, so he will continue to attend our meetings as well. Angie, anything else? Did I forget anything? Thank you so much. Well, thank you everybody for joining us. The meeting will be adjourned after a motion from one of the committee members. Mr. Rangel makes a motion. Marina seconded. All those in favor say aye.
Aye.
The meeting adjourned at 6:24. I love efficient meetings. Thank you for being here. And we will see you next month.
Are we
We're gonna
taking a
take
photo?
Group picture.